Welcome to Trying to Conceive with Dr. Sasha Hakman, where we break down the science of fertility, share real patient stories, and explore the latest innovations in reproductive medicine. My name is Dr. Sasha Hakman, and I'm a double board certified OBGYN and reproductive endocrinologist and infertility specialist. I practice at HRC Fertility in Beverly Hills, but this podcast is an independent project created and hosted by me separate from my clinical work. Don't forget to subscribe so you never miss an episode. And if you want exclusive updates and resources, be sure to sign up for my newsletter. Just click the link in the episode description. Jessica Zucker is a Los Angeles-based psychologist specializing in reproductive health and the author of the award-winning book, I Had a Miscarriage, a Memoir, a Movement. Jessica is the creator of the viral hashtag I Had a Miscarriage campaign. Her writing has appeared in the New York Times, the Washington Post, and she's been featured on The Today Show and Good Morning America, and recently released her second book, Normalize It, upending the silence, stigma, and shame that shape women's lives. In today's episode, we're talking about pregnancy loss, the shame and self-blame associated with miscarriage, and how to handle the grief and trauma associated with infertility and loss. Well, I want to thank you for being here.
I'm so happy to be with you. Thank you for having me.
You're amazing. Your book you're an incredible writer.
Oh, thank you.
I've read the book in its entirety, Normalize It. I still have to read I Had a Miscarriage in its entirety.
Well, you can wait on that until you're done with pregnancy.
But I mean, I'm not pregnant right now, but
right. I know. But if it's in your future, I wouldn't want to put it in your head, probably. So.
Yeah, I mean, I've seen a lot,
I know, that's true.
I'm not naive to all the possibilities and what could occur. But I mean, what I love about your writing is, first of all, I learned a lot, even as a physician, even as a reproductive specialist. I think that it's really amazing that you were able to sort of separate all of the different things that cause us shame and grief and all the stigma surrounding women's bodies and intimacy, friendships, relationships, obviously reproduction.
Yes.
So infertility, pregnancy loss, and there's so much to it. So I think that this is a good book for every woman to read because there's something that's applicable to everyone.
Thank you. You're going to be my PR person moving forward. I'm going to hire you.
I truly mean it. I mean, I loved it so much that I want to read it again because I'm forgetting the details, so
Amazing.
I need to read it a second time.
Maybe I should read it again. So. It's been a while. I don't know all the details
anymore.
Sure
it was a labor of love.
You know, writing books is quite an undertaking. And
yes, that's what I hear.
I'm so glad I did it. I think the first book, it was my heart and soul. It was blood, sweat, and tears, writing a memoir and sort of getting into the messy details of one's life. I mean, it's a memoir, but it's specific to miscarriage. But that, it takes a lot. You know?
I'm sure.
And it's such a singular journey when you're writing a book, because it's like you, yourself, and the page. But then it comes together. And hopefully it changes lives and it feels so worthwhile.
I'm sure it has. For our listeners who don't know your story, do you mind sharing a bit about what you went through and what prompted you to write these books?
Sure, of course. So I guess I'll go back. So I'm a Los Angeles-based psychologist and I specialize in women's reproductive and maternal mental health and have done so for about 16 years maybe at this point.
Amazing.
I always have to just remember how old my son is. And I started my practice before I was pregnant with him. And I had come to the field with a background in public health. So I had worked in international women's health prior to pursuing my PhD. And I knew that in my clinical practice, I wanted to sit across from people and talk about these issues. And it was just pure passion, right? I was just interested in all things women's health. I had not lived through anything specifically that sort of informed my career trajectory until I did. So I was 16 weeks into my second pregnancy and had a miscarriage while I was home by myself. I mean, it's the goriest story. I mean, so I don't have to tell you all the details, but
I read about that.
Yeah, because you probably don't see this. Like my OBGYN, this is not the norm. And so people should know that.
Yeah.
And that is why there's the 12-week rule, which we can talk about questioning, because a majority of miscarriages do happen in the first trimester. But there was a chromosomal abnormality we learned later. And so, ultimately, I guess I was grateful. It felt like my body was actually working, that I had a miscarriage. It was just the way that it unfolded that was so incredibly dramatic and traumatic and just shocking. I mean, I had never heard a story like this before. And again, I had been sitting across from women and families all these years hearing about their losses.
I wish I could say the same.
Well, typically it's, you've heard stuff like that.
Okay. I've had patients go through that. It's so brutal. Yeah.
Yeah. It's usually, though, what I've heard is like you go to the doctor, there's no heartbeat, you schedule the DNC,
Right. And that is the most common scenario.
Yeah.
Or there's some mild bleeding, freak out, go to the doctor's office, and then confirm.
I know. And so that was the thing. It was like I had some bleeding. I went to my doctor. Everything was perfect. Went home. That night I could barely sleep. I was like roiling in pain. I knew that there was no coming back from this. But it was just so interesting that everything looked fine. And then the following morning, I was in so much pain. I got into the bathtub and just like was trying to do anything to kind of deal with what I was going through, both mentally and physically. My husband took my son to preschool, and my husband had a big work day. And I was like, just go, because there's nothing that you can do, which of course I regret in retrospect. Yeah, so I had scheduled an appointment with the specialist, even though he was like, I can't do anything for you. But I was like, well, I just want to try to figure out what's happening here. And so I was trying to get myself ready to go see him. And suddenly I started like having what felt like a panic attack, even though I haven't experienced that. It was just like dizziness, and not even dizzy, but just overcome. And then I was kind of clammy.
Oh my gosh.
So now I realize it was labor.
Yeah.
And so I went to the bathroom and sat on the toilet thinking like, let me just pee and get a cold compress and just like take a breath. And the fetus came out.
Horrific.
It was unfathomable. And luckily, I'm close with my OBGYN, so I texted her and she called me and she walked me through what to do. I was not comfortable with the idea of, calling an ambulance and having random dudes running through my home when I had a fetus dangling from my body. So,
which I don't think people realize when you're in the second trimester, the placenta does not separate easily.
No.
So, yeah, your fetus, your baby would just be attached to you.
Yeah. And what would they know?
Still that umbilical cord attached to the placenta in the uterus. And what do you do?
What would these men have done? I mean, I was picturing.
They would not know.
No.
They would not know what to do.
No.
I mean.
No. The whole thing, because at the time my house had many stairs. So I was like, wait, how would I go to even let them in holding the baby? Anyway.
Oh, yeah.
So she walked me through what to do. So I cut the umbilical cord myself. And then as you know, you start to hemorrhage. And I put the fetus right next to me alongside the bathtub.
That's got to be the most...
That was like
heart-wrenching, surreal, you're in a parallel universe. This isn't real life.
I was like, wait, she looks like her brother. Like I did have this like moment of like, and I wasn't trying to study it or her. I wasn't, it's just like, it's so traumatic. It's such a flash, and I was alone. So I didn't know how to make sense of anything that was happening. So the only sort of way I felt grounded was through hearing the voice of my OBGYN. And so she stayed on the phone with me until my husband got home, and she instructed us to bring, of course, the fetus in a bag to her office to be tested. And I mean, I had to, put towels down my pants because I was going to hemorrhage until the placenta was out. And by the time we got to her office, when I took the towel out, literally a boulder size clot came from me, splashed across the floor.
I believe that.
And the nurse was like, it's like a murder scene in here, which I'll never forget, which she didn't need to say that. But
yeah,
it's interesting. Like when you're in a trauma state, you notice everything. And like the hypervigilance is just turned on 100%,
Yeah.
And so,
excuse me,
it's just, interesting what people say and what people don't say and how that stings or doesn't. But we can talk more about that as well. Anyway, I was then faced with the option of either waiting for anesthesiology and having a blood transfusion or undergoing an unmedicated DNC. So I just quickly asked her loads of questions like, how long will this take? What will the pain level be? What will I be hearing? What will we be seeing? Just
right.
And I opted for that. I felt like at that point, how can the pain be worse than it already is? Physically and more so emotionally.
Right.
And so that's what happened. So it's like I lost the pregnancy, I'm hemorrhaging, I'm home by myself, and now I undergo an unmedicated DNC with like the sound of that machine that will forever be seared into my cells and my psyche.
What did you notice from loved ones after you went through this? Like, were you quick to share? And if so, what was your perception as now the patient? Before you were the psychologist and now you're the patient going through this.
Yeah.
I'm sure it's a very different perspective now.
I know. And I think it was very different perspective. And I think with the hormones shifting and the grief raging, I was so sensitive to the things people said. And now I realize, like, I look back and think, have I always been sensitive enough in my role as a psychologist, but even as a friend with people who have gone through these things? Again, not second trimester usually, but nevertheless, have I been sensitive enough? Because people want to focus on the bright side or the silver linings. At least you can get pregnant. At least you have a healthy child.
So you still heard that?
Oh, yeah. Oh. I mean, I heard the craziest things and received the funniest gifts in the mail. And like, and then it was really intense because I returned to work too quickly. And I write about that in my first book. I don't have HR. I didn't know who to turn to get a real sense of like, what should I do for myself? And I've never been through anything like this. I really didn't want my patients to begin to worry about me. I think that was a big focus. And I don't know if you have felt that way, but I had to be honest with them. Like, this wasn't the kind of thing that I could just brush under the rug or sort of, replace what happened with a fictitious story to make them feel better, which I wouldn't want to do anyway. But like, I was visibly pregnant. Everybody knew I was pregnant. So I had to make the decision, what do I share? So I let them know I had a miscarriage. But then, it's an intimate relationship. Oh, so you went to the doctor and there was no heartbeat? No. Wait, what happened? How much do I tell them?
So tricky.
It really is.
And it's like there's always that weird blur of what's professional versus what makes a patient feel more connected and trusting of my care.
And I was actually so in it that I don't know that I could see those lines as clearly as I normally would.
Of course.
And I think that my humanity was probably very refreshing for some, but I do think that a couple of people were terrified. One person remarked, and it's in my first book, something like, if this happened to you, it means it could happen to me. So that sort of bleeds into this idea that people somehow think that miscarriage is contagious, and that by talking about our difficult stories and our challenging life events, that we can maybe infect one another, which was fascinating and hugely troubling to me, of course, to hear something like that. And she did leave my practice. And I understood, I think people hope that the people they hire won't go through the things that they're there to deal with. And we hope so too, so that we can be consistently available to them and not sort of be down in the trenches, but life happens.
Yeah. Today, I want to talk to you about a tool I personally recommend to my patients who are trying to conceive, Inito. Inito is the first at-home fertility monitor that tracks 4 key hormones, estrogen, LH, FSH, and PDG, using a single easy test strip. And in just 10 minutes, it gives you incredibly accurate hormone readings, but without the stress of lab visits. Inito can help you detect your fertile window with precision, predict ovulation reliably, and then confirm ovulation has occurred, giving you a complete understanding of your cycle. This comprehensive hormone tracking becomes particularly critical when we consider anovulation, which is the leading cause of infertility and often goes undetected. Inito serves as an indispensable tool here, not just for predicting ovulation, but more crucially for confirming it. It achieves this through a sustained rise in PDG, the urine metabolite of progesterone. As a physician, I trust the data Inito provides. I use it to monitor how my patients are responding to treatment, and I can adjust their plans in real time based on actual hormone levels. So if you're looking to take control of your fertility with clarity and confidence, I highly recommend Inito. Head over to inito.com and use my code TTCpodcast to get your starter pack for just $89. That's INITO.com. Yeah, and I mean, it's interesting because I've been so open about navigating infertility and my diagnosis, and it's really funny how in the infertility world, it's almost like it's a good thing your doctor went through it. Okay.
Yes.
She physically knows firsthand what I am going through.
Yes.
And obviously, emotionally, everyone's different in how they cope with things. I'm a huge intellectualizer. I intellectualize things. I mean, it's not surprising. I'm a physician, but I do think, and we talked about this before we started recording, how everyone sort of clumps, and I'm guilty of it sometimes too, infertility and pregnancy loss in the same category.
Yes.
But we talked about how with my infertility, I have no idea what it feels like to experience a loss. I can imagine that it is brutal and the grief associated is immense, but I've never gone through it. And in your case, people have often assumed that you've dealt with infertility,
right? But
you've gotten pregnant fairly easily, but experienced loss, which it's a totally different type of grief.
It is. Well, so did you ever do transfers, though, that didn't take, and do you consider that loss, or? So
I was very lucky. My first transfer worked.
Okay.
I never considered a negative pregnancy a loss. I considered it a failure of my body to do what it was supposed to.
Oh, no.
Even though I knew the science, even though I know that human reproduction is not efficient, that, and it's because in my circle of close friends, I was the only one. Infertility is common, and yet somehow I was the one who. I think we tend to romanticize this thing where, okay, I'm ready to have a baby. I'm with the love of my life. We're gonna have a really good time, and then I'm gonna get that fun little surprise of, oh, my period is late.
Yes,
there's a positive pregnancy test, and I almost like internalized like my husband would probably find me more attractive if I got pregnant right off the bat. I don't know why.
I wonder where that's
I
coming
have
from.
no idea. I have no idea. And
Interesting.
he's never said anything or felt that way. And in fact, when we started dating, I was like, by the way, I have PCOS. I don't ovulate. We're going to have to do XYZ. And he's like, okay, no problem.
Whatever,
Sure.
as long as we can also have fun. Yeah.
And so, I think, it was maybe our second year of dating. We had just technically legally gotten married. Nobody knew about it at the time. and then we made embryos.
Okay.
It was just for fertility preservation. I didn't think I'd ever need to use them. So it was very sort of like,
oh, that was smart.
yeah, we're just doing it for backup, but we probably will never have to use these embryos.
Oh, so you were going to just try to conceive for...
Correct.
Yeah, because...
Yeah, it was just for me, it was just for good measure. Because I've seen so many women who they have their partners. Once they've decided that they're ready to have a baby, that's when they get that surprise of, oh, it's not working.
Yeah.
And then they come to me and they think, and I think if they're good prognosis, that we're going to do IVF and it's most likely going to work. And then you have a percentage of patients where, oh no, this is not working. IVF number 1, IVF number 2, IVF number 3. And I'm not even talking about embryo transfers. I'm talking egg retrievals. Oof. And it's cycle after cycle. And it's physically so hard, financially, a huge burden.
Yes.
And then worst of all, they don't even get to walk home with a baby yet. And so I felt just very, very, very grateful that I had the ability to preserve my fertility.
Yeah.
And not everyone has that access. Obviously, it's perks of the job.
Right.
And so I thought to myself, I can't be the reproductive endocrinologist that can't have a baby because I didn't prepare. So that was my...
Very wise.
That was my viewpoint. I also come from a family of significant infertility. I mean,
Okay.
a lot of my aunts are childless because of infertility. One aunt did almost 10 years of IVF and had a pretty advanced loss with the first one.
Oh, no.
With the first pregnancy. She ended up with 3 kids, but and she's the best mother to them. I mean, it's insane. Her love for them is just so insane. I mean, almost every mother's love is amazing, but I think in her case, she wanted it for so long that she was, no matter how hard it got, she was just so happy that it was hard. She was happy it was hard.
She was just so relieved to be in the role.
Yeah, yeah.
Wait, so we should go back to this idea, though.
Yeah.
Because now I wish this was in my book.
The whole attractive thing?
Yeah.
I don't even know why.
I don't either. So it's a cultural sort of hand-me-down. It's like a
it must
societal,
I mean, I'm Middle Eastern, so there's a lot of flaws in our culture when it comes to women's bodies and how we view ourselves. That's for sure. I mean, when I think about it, I don't think that there's anything that my family has even ever said, especially because my parents dealt with infertility. They saw so many fertility doctors. They've always been so open about that. And my mom said, like, you were our first child and it was the best time of our life. Like, we just couldn't believe we got there. And she had been told by fertility specialists that she would never have kids. And so, it's really weird coming from a family where they've been so open about their infertility, even when I was a child, them talking about it. So it's really neat that as a kid, I got that exposure of not everyone has it easy. It doesn't just happen. Yeah. Sometimes you have to work really hard to get to baby.
And so was your mom so supportive when you were going through your own journey of trying to create children?
She was. She felt like I was a little extra paranoid. And she felt like, from a non-medical perspective, that I think she thought in her mind, well, my daughter even though she's gone through infertility. Well, my daughter's young and healthy. This is just going to happen for her.
I know. Everybody wants to think that.
Yeah. And so she's like, I think that you're just putting too much pressure on yourself.
And that you'll be more attractive if you do just get pregnant right away.
Yeah, maybe.
It's all part of the same thing.
But when I explained to her, the science and everything, she's like, okay, that makes sense. But even then, there were sometimes moments where she's like, oh gosh, I know when we started trying for baby number 2, her and my husband were both like, yeah, we really got to try for this naturally. We got to try, and if it doesn't work, it doesn't work. We do another embryo transfer, but we got to try. And so there was always this bit of pressure of like, okay, just try. Don't not try.
Yeah.
Like I wanted sort of the easy way, I guess you would say.
Right.
Of, okay, I want baby number 2. Let's just transfer the next embryos.
Yeah.
And see if it works.
Right. Well, also because then I guess you have the assurance that it's a healthy.
Well, we actually never genetically tested our embryos the first round.
Interesting.
Yeah.
Oh, okay.
It was primarily from a financial standpoint for me.
Oh, interesting.
I was still in my training, and as you probably know, doctors in training do not have enough money to afford the luxuries in life.
Right.
And I knew, the data. I was under 35,
right.
And statistically speaking, there's probably a baby in there at least, and genetically testing the embryo, which is PGT, shortens time to baby. However, it doesn't increase your chances at that age.
Okay. Wow.
And I thought to myself, what's really funny now that I have kids, I completely disagree with that viewpoint. But I thought to myself, if the transfer doesn't work and I have a loss, then that's what was meant to be.
No.
And I can handle that.
Like, no.
And now, my first pregnancy, I had a subchorionic hematoma, so I had a lot of heavy bleeding. And so before I scanned myself, I thought I was having a loss, and the immense feeling of panic that took over, I was like, gosh, I never mind. I take it back. I take that back.
Yes.
If you can avoid a loss, you should always avoid a loss.
That's what I thought. Everybody tested embryos because that was part of like the perk of, IVF.
It's a little controversial because it doesn't even, it doesn't completely prevent a miscarriage.
No.
It helps in most cases overcome pregnancy loss due to chromosomal abnormalities, which is the most common cause.
Exactly.
But the most frustrating thing about miscarriage is that, especially for women with recurrent pregnancy loss, half of the time, even when you do a very comprehensive evaluation, you will not find a cause.
That would make me pull my hair out. I mean, I will admit that for me personally, knowing why my loss happened helped enormously.
Totally.
Yeah.
I'm sure it helps with closure.
It does. And it's like, it could still happen again, but for some reason I told myself like, okay, it happened. I don't think this will happen again. That's just not scientific by any means, but if I didn't know, I would have questioned, and a lot of people seem to do this. Is something wrong with my body? Is it something I did or didn't do?
Yeah.
And I didn't go to that place at all.
Can we touch on why women tend to do that? They tend to blame themselves a lot. I always stress to patients that it's not your fault. You didn't do anything. But I get the whole, well, I ate this the other day. Is that why? I carried my toddler. I had to wrestle my kid to brush their teeth. I went to the gym. I went on vacation and went on the plane ride. And there will be all these fixations on everything that they did leading up to the loss.
I think it just boils down to a feeling of wanting to secure a semblance of control. If I was part of creating the loss, I can be part of not having a loss next time, right? So, and I think as women, we're sort of told from the get-go, that if we try hard enough, we can achieve X, Y, and Z. And oftentimes that's true, but reproduction is sort of out of that realm. And blaming oneself, I think, also prevents people from really sinking into the depths of the grief. It was the coffee. It was, the orgasm I had. It was intercourse. It was, working out. And then again, next time I won't do that. Or if I can blame myself, then I can feel like it was me. I should have known better. And it somehow seems to protect people, or so they think, from, again, sinking into the intense pain.
So how did you knowing what you know, how did you handle your loss? Like, how did you handle that grief? Because I often see in most cases that my patients will they will grieve this, obviously. But then I've also seen patients who are very much like, okay, on to the next. What's next? Next step. It's okay. No worries. It's okay. I'm fine. Stop checking in on me. And I know that obviously it's a coping mechanism. And sometimes, or maybe, is it not? Is it just that?
I know,
it
it's so
isn't
individual.
Always something to grieve for everyone.
That's true. I mean, that is true. I mean, I've had patients and friends over the years have like a gut feeling that something was wrong, and then they have a loss and they're actually not relieved, but like they knew and it's okay. And they just want to try again, and I don't think they're denying something or not allowing themselves to feel. And for some people that have an early loss, I do think that they just want to get on with it.
Yeah.
And it's not like they're not sad, but perhaps they hadn't become as involved in it or as attached to it. Or, so many people start imagining the future. Maybe they hadn't. Maybe they're too busy.
Right.
Maybe, this is their first pregnancy, so they're sort of unaware of what to kind of plan for or think about. And for me, I don't know. I mean, being a psychologist just didn't prepare me for this. And I think that just makes me human. I think that going back to work so quickly was probably not the best idea. And yet I also didn't feel like laying in bed by myself at home was going to help me move forward and integrate this experience into my life. And I thought I should be doing the stuff that I love to do, which is work and interacting with people and helping others. And I felt at least grateful that I did not find myself in this spiral of blaming myself. I was concerned about getting pregnant again. I was concerned about the sort of time that was lost. And
yeah, that's a big one. It's a big one.
I think I was 39 at the time. So I was, feeling like if we're going to do this, we don't have time to grieve for too long. We just have to at least try again. And I can grieve during the pregnancy, or I can somehow shove it away, which is sort of part of what I did, I think. And then when my healthy daughter was born, so my OB suggested I wait 3 cycles, and then I got pregnant on the next cycle. So that's pretty fast.
Yeah. I mean, that's amazing.
It's amazing. But I was also just wait,
how do I process this?
Yeah. I was just like a deer in headlights. And the fear level was so excruciating. And every time I went to the bathroom checking for blood, it was a lot.
Yeah. Was there this thing in your mind of, once I pass that gestational age, I'll be okay?
That's a great question. I remember I got the CVS because in that second pregnancy, I was actually about to have an amnio, I think 2 weeks later. I know it's so old school, the amnio thing, but And I would have learned that it was a chromosomal abnormality, and I would have terminated the pregnancy. That's what we had talked about and decided together. And I do sort of feel comfortable sharing that. I think it's important that we talk about terminating for medical reasons because of how politicized it is and how sort of outside of the loss community it can feel for people who go through that.
Totally. I think people forget it's often a desired pregnancy.
That's the thing.
Yeah.
It's like, why are we...
It's a brutal termination.
Exactly.
It's the baby you wanted, but...
That's right.
But also don't, like, it's a, let's just call it what it is. It's a lifestyle changer.
It is. And also it may not just be, something that hinders the way that you live a little bit. It could be that this baby or this person will not actually have a true life.
Yeah. And that's what I mean.
Yeah.
I mean, you're watching your child probably suffer and then die. And
it's really intense. But I've had a lot of interesting interactions on Instagram over the years about this because a lot of people in the pregnancy loss community don't want to include these people. And they're saying, wow, I would do anything to be pregnant. How dare you make a decision like this or things like that. So, I myself would have opted for that. And so I think once I got to 12 weeks, so I ended up having a CVS in this third pregnancy because, of course, I wanted the information as soon as possible.
Right.
And I'll never forget when the person called with the results. Like, I started crying and at first the woman on the other end of the phone was like, "Aw." And then I just didn't stop crying. And she was like, "Are you okay?" And luckily my husband was home. And I said, "Yes, this is just the most relieving news. I'm just going to let this out right now." So it's like, I think I was holding my breath that entire time in the pregnancy. So that was helpful to know that things were healthy. But you're right. Then when I got to 16 weeks, I think I felt that much more comfortable. But for me, since I had sat across from patients who had gone through stillbirth and terminating after the 20-week scan and infant loss, those stories were lodged in my mind. And I now knew that anything could happen.
Yeah, it's that form of recall bias after you've experienced
it.
Yeah.
Right. And so the truth is, until my daughter was born safely, I don't know that I fully trusted that things would be okay. And then, interestingly, even when she was born, I realized, like, oh, now I have to deal with the grief I didn't deal with and the anxiety I just had for these 9-10 months.
How did it feel when your daughter was born? When it came to, I imagine that there's got to be this weird sensation of you've moved on from that other child and like almost not giving them the platform that they deserve, if that makes sense.
Totally.
I mean, is that a thing that...
that's an interesting way to put it. I mean, I think honestly through, creating this whole I Had a Miscarriage Instagram campaign and all of my writing about it, it felt like I had honored that pregnancy and that pain and that, person to be that wasn't. But it was, it was still hard to trust. I mean, I remember she came out quiet. My son came out screaming. And so I just thought that like everyone does. And I remember saying to the nurse, like, is everything going to be okay? Like, what's happening here? And she just was like, she's just taking it all in. She's just calm. And I could see that my anxiety had transferred now from this idea of her not making it to then being like, is she going to be okay in the world? And I know it was troubling. I felt very connected to her, like attaching and bonding. That wasn't a problem, but I had anxiety for a while.
Yeah.
Yeah.
I think that the anxiety is pretty universal amongst anyone struggling with infertility and has had a miscarriage or multiple miscarriages.
Yes.
And one thing I feel like we don't talk about enough is that anxiety, if you don't deal with it before baby, I think it really translates into massive intrusive thoughts of things happening to your baby.
I know. I mean, I've heard so many stories like that. And I feel so grateful that I did not have those thoughts. But there was one day when she was coughing and then it felt like she was choking. And I literally thought that this was the end. The high alert feeling didn't calm down for quite a while. And I think you're right. I think we have to kind of take our emotional temperature. We have to sort of have a sense of whether or not our anxiety is in the normal range. If it's not, we do need to get help, whether that's through a therapist or medication or talking to your OBGYN and getting, help that way. But yes, I mean, I think we just have to know for ourselves, and hopefully those around us give us feedback too, if people realize, or the pediatrician notices, or your doctor at check-ins realizes that you seem a little off, or you seem a little, like you're struggling. It's time to get help.
Yeah. I feel like there's really, I mean, we it's being talked about more now, but there's definitely not enough in the postpartum phase to help screen for that.
I couldn't agree more.
Just giving a questionnaire immediately after you've delivered, especially because, and I want to dive into this a little bit more, the shame associated with the fact that I've been wanting this baby for so long.
Right.
I now have this baby and I'm so happy. I love this baby so much, but I'm suddenly feeling sad. I'm feeling anxious. But I don't think that most women are completely honest in their questionnaires. And if we're using...
Do they even have the questionnaires? Why is this not a universal thing in this country so that at every office...
Well, I think they should be universally giving it immediately after delivery, but then there's really nothing for 6 weeks.
And that's when we need it.
And there are tons of things that can happen. Postpartum psychosis is rare, but it's very severe.
Yes.
And I think that even if it starts immediately after delivery, I still think that you're still in this weird high of, you just either went through labor or surgery, you're feeling pain, you're now getting milk let down, which is a whole other thing.
Yes.
And you're feeling this sense of joy and overwhelm, and you don't know how to translate that into this questionnaire of do I feel sad? I don't know.
Well, also you don't have sleep deprivation yet.
Right.
Which adds to all of it. Right.
Yes.
So the 6-week time frame is very important.
Yes.
I mean, I even think it should be at pediatricians' offices that they integrate that into the care. Some
do, but I still think it's inadequate when you don't have a rapport with the pediatrician in most cases, especially for first-time moms. This is the first time you're meeting this pediatrician. Right. They don't know you. You don't know them.
That's true.
And because there's so much shame surrounding postpartum anxiety and depression, I suspect that a lot of women are not willing to admit, even to the doctor, even if they know that it is completely confidential.
Yes.
They just don't want to admit it because how can I love someone so hard and be so happy that I'm here, but also feel sad?
I know. Well, it is very confusing.
Very.
And I think for some people, it's not even conscious that they're not telling somebody else. It's they're so in their head about it. And it's wait, am I imagining this? Is this going to go away? Oh, maybe I just need one night of good sleep. And then you're hearing from everybody, oh, you just need fresh air. You just need, why don't you get some exercise? People tend to minimize it because they don't know maybe what's burgeoning, what might be bubbling up. And then we internalize that and do it to ourselves. But you're right. It's how can I say out loud, I'm struggling?
Yeah.
And I love the role of motherhood, or, and I love my baby, or, and I actually don't feel those things. Like I wanted this and now I'm in it and I'm freaking out, because those are the people who end up struggling very intensely. And you're right, the shame and the stigma and the silence is crushing.
And I think that probably the reason they feel it so intensely is it's hard to separate that you love your child, but you hate this role.
Exactly. Like
I feel very fortunate that I love this role. I love it so much. I want to do it again and again. But that's not everyone's story.
No, it's
and
not.
I love that even in your book, you talk about pregnancy loss as for some it's grief and for others it's relief. And then same with pregnancy.
Yeah, exactly.
For some it's the ultimate joy, and others it's like, what the hell? This sucks.
Totally.
How do I get out of this? You know?
I know. It's like, I still don't understand why as a culture we can't integrate the true complexity that is being human and that is becoming a mother, because we would all benefit if people could just talk more openly about it. Then you get the help you need. And then you find your groove.
Yeah.
I mean, you know, it's like if people do get help for anxiety or depression post-baby, they feel good.
Yes.
They return to themselves. They feel connected. They can, you know, engage with their children. They can feel, you know, like motherhood is this wonderful thing. But until then, maybe
it's
not.
So true.
And you feel lost.
And I was listening, well, it's probably been a couple months now, when you were on Shenanigans with Sheena Shea. Yeah. And she was sharing her journey, saying, I just thought I was going to get out of it.
I know.
I thought it would go away.
Of course.
And I think that that's the case with a lot of people where...
Yeah. I mean, when you're having intrusive thoughts, when you don't know, you know, your best friend like hasn't gone through it, like there's no point of reference to know if it's normal or if it will go away or if you need help immediately.
Right.
You know, until it gets bad enough that you do sort of share it. I don't remember how she eventually got help for it, but I'm so grateful that she's so open.
Yeah. The openness, and you talk about this a lot, that is what helps so many. And from even a personal standpoint, one of my closest friends, she had 2 under 2 right before me. We had a very similar but different sort of way of getting to 2 kids, where she had gotten pregnant very easily the first time, dealt with secondary infertility. I dealt with primary infertility, but was able to conceive spontaneously the second time.
Right.
But the pregnancy interval was very short. And she was very open about her mental health being in the gutter.
Yes.
She was mothering a lot by herself because her husband is also a physician, super specialized, but he was doing extra training. So he had to go and even travel a lot because of that. And so she just felt extremely isolated and fatigued. And so when I was going through it, I was feeling a lot of that. And it made it so easy for me to pick up the phone and call her and know, okay, I have this person to talk to about how I'm feeling.
Such a relief.
Because she did that with me the first time. And it's almost like it opened up space to say, okay, it's okay to feel this way.
Amazing.
This is normal. Like, women go through this all the time.
Yes.
And it's not shameful. And even the best part is she's so matter of fact that it just takes away any stigma. And so it's very like, you need to sleep, you need this help, this is what you're going to tell your husband, this is what you're going to tell the nanny, this is what you're going to tell your parents.
That's great.
And this is what you're going to do. And,
that's great.
And it was nice to have that person to just sort of tell you, I know you well enough to know this is what you need right now.
But a lot of people don't have that.
And a lot of people don't have that. But this is why I feel like building a community where women openly talk about what they're going through, what they're feeling, normalizes it.
Yes. So let me ask you this. I mean, I don't know if you can answer, but like, if your friend hadn't shared that and you had been feeling these things, who do you think you would have turned to? Or do you think
I would have just kept it to myself.
Yeah.
I would have felt like, well, none of my friends have gone through it. So there must be something wrong with me. Like, why am I the only one? What's wrong with me? Like, even if it's physiologic, even if it's biology that I can't control, there's still something wrong with me.
Wow.
And so it's that sense of internalizing some form of failure even.
Yeah.
And I just feel like it's very common.
It is. Your patients will be so grateful that you are so open and so real about what you've been through. Yeah.
I think it's important. I mean, and same for you. You've changed so many women's lives.
I hope so.
And probably men too. I'm sure men who have listened to this have sort of understood, okay, this is how I can support my partner, and also this is how I'm feeling going through this.
Yeah.
Because
do men listen to this?
Very small percentage. When I look at my my demographics on Instagram, it's like 5% men. You know, there's that 5%, a very small percentage. I still think that, I think women are doing a lot of the homework. But I think that there is more and more encouragement for men to really be a part of this. And it's interesting because in clinical practice, I see it very, it's still a minority though of couples that come in together and they do everything together.
Wow.
And in many cases, I've really never even met the partner.
Oh my goodness.
Yeah.
Whoa.
Like have seen him once at the time of egg retrival, and that's about it.
Wow.
And so, and I get that life is busy.
Yeah, it is.
And sometimes it's hard to, it's really hard to make it to all the appointments.
I mean, there's so many appointments.
And I never expect that. But I always say, like, and we always ask, like, come together at least for the first appointment because it's important to get both of your histories. Like, you're doing this together. Yeah. It's really, I don't know why there's this sense of it is on the woman to do it all.
Well, and then, you know, when it's a male factor issue, talk about the silence, the stigma, and the shame around that. And not talking about it, and like the assumption that it's about the egg and about the woman, I think is really fascinating as well, and troubling.
Yeah. And I think that tends to happen very commonly, except for in most cases in the fertility office, where we're always from day one, like, I need the semen analysis.
Yes.
We cannot move forward with anything without that.
Yes,
and there will sometimes be couples who will say, well, we just want to start treatment. And like, for me, I insist, I'm not prescribing anything until I know what sperm looks like.
Yeah,
I'm not wasting
your
time.
Information.
There could be no sperm. I'm going to prescribe you a medication with the possibility of side effects.
Right.
I mean, yes, they're relatively safe, but there's always risk with medication. No matter, there's risk with anything you do.
Yes.
Got to know that it's indicated.
That's right. Very helpful.
Yeah. Well, I mean, this has been so amazing chatting with you. I feel like we can.
Too.
This has been such an incredible conversation. I think that you're really helping to make moves when it comes to talking about pregnancy loss. And I really appreciate you being so open about your own story and everything you've been through.
Yeah, thank you so much for the incredible work that you're doing as well.
Thank you.